Okay, so I'm Zatisha,
I'm Jada.
and we're going to be talking about masticatory muscle disorder interventions. We'll give a little recap on what we talked about last semester, while also adding on impairments that could lead to functional limitations in patients with this disorder. And students will be provided interventions and pictures. So, just a little recap. We all know that the masticatory muscles are the masseter, lateral pterygoid, temporalis, and medial pterygoid. And we know that the masseter elevates, protrudes, and retracts the jaw, while the lateral pterygoid depresses and protrudes. The temporalis does retrusion and elevation, and then the medial pterygoid does protrusion and elevation as well. And they all help the jaw move lateral directions. And we know people with this disorder, it usually comes from overuse, tensile strain, guarding, and like different parafunctional behaviors like chewing gum, chewing on straws and pins, and things like that.
The impairments that we decided to do were decreased range of motion or muscle extensibility, decreased strength, and impaired ability to masticate. So for the first one, we're going to go over exercises that will improve range of motion and muscle extensibility. So during the maximum protection phase, the intervention will be relaxed jaw opening. There was a research study done that said relaxing the masticatory muscles of the jaw helps to improve their extensibility and range of motion, because a lot of times these patients will have muscle guarding due to pain and things like that. So just being able to relax these muscles will essentially help with range of motion. So I would instruct my patient to place her tongue to the top of the roof of her mouth, right behind her teeth, so it will be similar to like saying something that began with an N. Okay, perfect. And then you're just going to allow gravity to pull your jaw down. So as far as it'll allow you to go, perfect. And breathe in through your nose and out through your nose, just to make sure that you are relaxing the masticatory muscles. Perfect. All right, the second one, I'm going to go to the picture for it because we didn't have anything for me to put in between her teeth, but it will look similar to this picture right here. And it's a sustained mandibular stretch. And so we would get the patient to open their mouth as far as they can without pain. And then from that point, we would put in tongue depressors to hold that position or extend that position if we felt like the patient could go a little bit further without any pain. And we would just hold that there, letting them have it for about 5 to 10 minutes, just to make sure that we're increasing that range of motion, but not necessarily activating those muscles. And then the last one, in the minimum protection phase, we would do masseter compressions, a masseter compression stretch and a side-to-side jaw stretch. So I would instruct my patient to put your hands on the side of your cheek, trying to find your masseter muscle. It would be easier if you clench down on your teeth and you feel it. And so from here, you're gonna press in slightly and then pull down. Perfect. And then you can hold it for about 5 seconds at the end and start over again. We can progress this stretch in this phase by doing a hold relax. So we know that the masseter is going to help with elevation, but when we stretch it, it's going to depress the mandible. So I would have the patient do that and tell them to hold, hold, hold. And I can apply a little bit of resistance right here. Hold, hold, hold. Don't let me move you. And then relax. And then after the intervention is over, the patient should be able to achieve more range of motion, and we just continue with that process until they don't improve anymore. Hold it. Got one more. And then, so we've addressed elevation and depression, and now we're going to address the lateral deviation. So we would have the patient you can use your right hand as a stabilizer hand, putting it on this side, and you're just going to push your jaw to the side of your hand. Hold about 10 seconds. Okay, and then you can switch to the other side. And then same thing here, we can add the PNF technique, so the hold, relax, just to maximize the amount of extensibility that they will be able to get.
So the what I'm going to be talking about is decreased strength at the TMJ, which could be due to like muscle tension, spasms, and the dysfunction that may be occurring. And then this could be due to like, it can cause functional limitations such as like difficulty chewing, speech difficulties, and limited mouth opening. So probably have difficulty talking, opening and closing the mouth, and which is things that we need to do every day. Well, things we need to do, but you know. So the first exercise we're gonna do is the isometric jaw exercise, which minimizes the stress on the TMJ while also maintaining the muscle and the muscle action. It's all about like you just basically, we know isometric holds. I'm gonna put my hand on the side to do lateral first, and I want you to press your bottom jaw only into my finger. And the book said it's good to only use, when you're starting out, only use like one finger weight. And then the other side. Okay, now opening is two different ways you could do it. You could do it this way, or you can kind of do it in like a protrusion like area, but I like to do that one separately for protrusion. So, okay, protrude against my thumb. All right, and then for closing the mouth, they say it's best, like she said, to have like the little things that you can put in there and put a certain amount to where she can like open it and bite down on it. That'll give it more of a stretch than doing it with your hands. Okay, so the second, for the moderate protection phase, we'll do you could do controlled mandibular opening and closing. She kind of did that with the first exercise she did, putting the tongue on the top and like opening the mouth, but with this one you will open and close. But you can also do palpation, and this will just facilitate muscle relaxation and strengthening, specifically when you're doing the inhibitory pressure, so pressing down on it. So, okay, so the first muscle I'm gonna do is the temporalis muscle, so which is like right up in here. And I'm gonna just, if she had MMD problems, she'll probably like feel some pain. You don't want it to be excruciating painfully, like pressing down too hard. You just wanna do apply a nice little gentle pressure. And you know, you can work around it, squeeze it, move it around, stuff like that. And then we know the masseter, if she were to bite down, it'll be like right there in that jaw area. So you'll do that. Well, work up in that area. And then I'm gonna switch gloves, because this one I was touching all on her face, and for the pterygoid, you gotta go inside. Come out. Okay. So with this one, I seen the picture with he was standing up, and I think that'll give me a little bit more like easier way to find it. Preference. Okay, so with this, is it like the masseter is right here at the jaw? These muscles, the pterygoids, are the inside version. And so what I'm gonna do, I know the jawline is right here, the TMJ. I'm gonna go in. And then right here for the medial one, I'm gonna do a superior, it's kind of like going down in an angle like this. And so I'm like rubbing it. And then for the lateral, it's kind of going in this direction right here. So it's all about playing with those muscles, you know. All right. And then for the minimum protection phase, I'll do some restricted protrusion and maybe some opening with a elastic band. But this, you can sit up. You gotta leave your glasses. Okay, I couldn't find a little small towel, so I got this, because you know we use TheraBands in the clinic for everything. You know, when you put something on somebody's face, you don't want to just put it directly on there. So let's see. Hold that for me. Alright, so I want you to protrude your jaw out and slow and control it back in. Out, back in. Okay, and then we're opening, kind of do the same thing, just switch it up this way. You probably could find something better, like a smaller pillowcase. All right, open. Is it up under your jaw? Can't really see. Open, slow and control it, closing it. All right. And so here, sorry.
All right. So for our last impairment, we chose impaired ability to masticate. So we've already worked on range of motion. We've already worked on strengthening with this patient, but they're still having some difficulties actually chewing. So the first intervention that we're going to do is a chin tuck. I'm pretty sure we all know how to instruct patients on chin tucks by now, but we will use this as a postural enhancement for this people with this condition. We know that chin tucks will activate or improve the deep flexors of the neck. So we also know that the muscles play an important role in posture. So these muscles will essentially keep the cervical spine in an appropriate position to where the jaw is not deviating in any kind of way. And it's also going to reduce the tension, being that the alignment is corrected. So I would just ask my patient to sit up straight, keep their head straight forward, and bring their chin back, straight back to their neck. Perfect. You go back out. And they'll do that about 8 to 10 times, 3 to 4 reps. The next one is going to be partial goldfish, which is basically just partially opening the mouth. But here we can watch for any deviations. Ideally, the patient will be in front of a mirror or something that they can see, something that will reflect the movement that they're doing so that they can see if they're deviating or anything like that. But we would have the patient to place their hand on their chin, or one finger on their chin, and then the other one is going to be around the TMJ joint. And all you're going to do is partially opening your mouth, so just like this, making sure that you don't go to the left and or right. If my patient had a deviation to the left or right, this is where I would correct that. You do one more time for me? Perfect.
Sorry.
All right, and then so the last intervention that we would do for this phase will be the patient actually incorporating chewing. So this is going to enhance their functional endurance. It's going to play a role in their strength, and it's going to mimic what it actually feels like to be able to chew. So, well, you can open this. And just chew. Slow and controlled motions. We're cueing the patient to focus on the adjustments we made during the partial goldfish. So if they were doing any deviations, we would be just informing them and making sure that they are being cognizant of what they're doing, how they're chewing. They chew about 10 to 12 times. And yeah, they would be okay. They could repeat it throughout the day if they would like to. But it's basically just getting them back in the habit of actually chewing.
And I realized I didn't say anything. Oh, these are the pictures for those exercises. But I didn't say about like how long to do like the isometric. I think we know like hold for 10 seconds. Probably do it just like a few times, maybe 10. And then when you doing the palpation stuff, just do that for like a few minutes because you're really working on relaxing those muscles, getting in there. Like I would say there's a time where you can talk to the patient, but you like all in their mouth, so it may be a little awkward, and that's okay. These are our reference. Any questions?
So, not like class-wise, how would you explain to your patient in the best way to say that's a functional exercise on chewing gum? Or will they have dentures in their mouth and they don't have to eat them? And it's sometimes stuff. Just kind of
It don't have to be gum. It could be like, I don't know the name of it, but anything that's really chewable and not too hard to chew. But I would just tell them like, the muscles that control your mouth opening and closing are really like tight. Well, at this point, you don't want it to still be tight. It's after a while, because if you get somewhere tight, it's still just gonna be having pain. So it's just be like, it's just practicing opening and closing their mouth,
And essentially, we will be able to tell them that this is what you do when you chew. When you chew gum, you're going through the same exact process you would be going through if you were chewing a piece of pizza, anything like that. So we're just trying to get them we're trying to get them used to opening and closing their mouth in like a rhythmic pace. You know how you do when you eat.
in
it might have been a precaution or contraindication in the acute phase, I don't know. But I thought that chewing gum wasn't super beneficial to increasing the range of motion in TMJ dysfunction.
Well, it wasn't in the range of motion area, it was more so in the area that's focusing specifically on chewing, like, because limitations with chewing affect how you eat food. Like with this, you may have to eat, go to solid food, you can't eat everything you want, like tough food, like steak, you know? And so that's kind of, we would do that kind of to focus on that part. And it wouldn't be in the acute phase, of course, that's why we had it in the max.
Yeah, and ideally, the patient will be really free of movement restriction. They would be pain free with that. They would have their strength back. So essentially, they have improved to where they can focus on the functional impairment, which is chewing.
And a lot of these exercises can be done at home. So if we just give them a great home exercise program and they actually follow it, then, you know, progress.
Any more?
Dr. Kyle?
What is the person doing on one of the slides with your visual? Looked like he had like 3 little straps or 3 bands
You know,
going across his chin.
I know exactly what you're talking about. That's the protrusion one
Okay.
with the resistance band. I couldn't find a picture to save my life with nobody doing that. So I went to an AI detector to give me the best picture I could find.
Okay.
I meant to say that in a day, but yeah, I had a AI come up with that picture for me because I couldn't find a good enough one. And I feel like that one was really, it had it right here below the lower lip, really on that jaw area, and you know, protruding it out. Oh, and I think I didn't note that whenever you're doing this, of course you don't want the mouth fully closed. You don't want it all the way open. You want it slightly open. So that's why I kind of look like you got a pushing out, you know.
And where's the picture with the one exercise that you all did with the resistance band, resisting mouth opening? Mandible depression.
It ain't in there. You know what? To show you right now.
I need that one.
I got you.
I'm gonna use this.
We'll put it on there.
We'll put it. I give you an updated
I'm learning from
PowerPoint.
you all. Teaching and learning.
You like how pretty the PowerPoint is too?
Yeah, I noticed that. Transitioning into the spring.
That's the right idea, right?
Good.
Hey, good job too. I also like how, that resting position of the tongue is really important, and you will really see that that is impaired in your patients who do have TMJ dysfunction. So one of the things that I kind of look at or ask my patient too when they first come in is when they're at rest, whatever, it's hard to tell if their mouth is closed, but ask them, where is your tongue? Where is it sitting? And then working on the exercise like your partial goldfish, that's a really good one of retraining, keeping that tongue in that position as you're doing that is a really good way of retraining that and transitioning that to the good job.
Thank you. Dr. Carter?
Yeah, and one more comment. When I tend to do the pterygoid releases, when I go inside the mouth, I tend to utilize inhibited pressure when I do those. So when I'm inside the person's mouth, I'm not doing a whole lot of movement, playing around. That's where so they feel like I'm not playing around in their mouth. So I find the muscle and I apply inhibited pressure and I let them know I'm gonna apply inhibited pressure until I feel the muscle relax, so they know what I'm doing. But inside the mouth, I'm not strumming or stroking as much as I would do on an external muscle.
It's usually a tender muscle, and I'm glad you brought that up. A lot of times I'll even go in there with my pinky finger. Sometimes you may find that you can get your pinky in there easier than you can get your second digit, your index finger. Different people have different size mouths and different abilities to open it. But a lot of times I can stick in there like this, a little bit easier. Tool in your toolbox.
I remember, I think I did see a picture where they did the index finger, and then in the book, I think it said sometimes they feel like they don't reach the actual muscle with the index finger, depending on how big the finger is. I forgot to mention that thing.